I was afraid to make this video, but let's talk about the pros and cons of finasteride for hair loss. I'm going to go over the evidence. I'm going to go over some of the controversies. I'm going to go over differing opinions. And I'm going to let you guys fight about it in the comments below. Let me know what you think. Finasteride is a great medicine in terms of efficacy for hair loss. Just like minoxidil, you'll start using it. It'll take 3 to 6 months to see those hairs come through. You'll notice thicker hairs. You'll notice some of those finer hairs coming back. It's not going to make a completely bald head turn into a luscious forest of locks, but it will help quite a bit. You'll notice a temporary shedding when you start using the medicine. Essentially, those thinner hairs have to be shed out for the thicker hairs to come through. And any benefit that you get from finasteride while you're on it will go away once you stop using it. First, let's go over the contraindications. It is contraindicated in females. If you are pregnant, planning on becoming pregnant, or even have the potential of becoming pregnant, you are not allowed to get near this medication. You can't even touch the pill because there is a concern that if you touch the powder, it will get absorbed into your skin and it will cause birth defects. Now, in rare circumstances, females can be prescribed this medication. Postmenopausal females is a good option. And then in certain scenarios where there's a good provider-patient relationship, you may be prescribed finasteride, but that is quite rare. It is usually only for men. Now, the most commonly discussed side effect with finasteride is sexual dysfunction. I will go over that in a moment, but let's talk about the other issues. One is gynecomastia, which is enlargement of the breast tissue. You can get testicular pain. Some people may get a rash. But the one that most people want to talk about is sexual dysfunction. There is a risk that if you take finasteride, you may well have decreased libido, difficulty getting an erection, difficulty maintaining an erection, and difficulty with spermatogenesis. There may even be an issue of retrograde ejaculation. The rate of these side effects is overall seems to be low, around 1 to 4% in most clinical studies. And in those clinical studies, once you stop finasteride, those side effects should go away. Now, there has been something that has been going on in the media and on Reddit talking about post-finasteride syndrome. This has not yet been recognized by the FDA, mainly because they say they need more information. But the idea is that these sexual dysfunction problems can last indefinitely in patients who take finasteride, meaning they have decreased libido, decreased sexual dysfunction. There are even mental health problems associated with it: depression, weakness, insomnia, fatigue, muscle wasting may even be associated with it. And there are some studies talking about how there may be a neurological association with the specific mechanism of action of finasteride and how it could affect brain function. So there is perhaps a physiological possibility for this, but it is controversial. There are some studies looking at sexual dysfunction with finasteride showing that there is no effect. There's no difference between placebo. And in fact, some studies have even shown that there's a nocebo effect. So the placebo effect is you take the placebo, but you still have the benefits of the medication. The nocebo effect is you take the placebo, but you have the side effects of the medication, even though you're not taking the medication. And a lot of people think that this is psychological. So someone tells you, if you take this pill, you may have sexual dysfunction, and then they develop sexual dysfunction, but it turns out it's the placebo. People say it's a psychological thing. It's hard to say. There are also some studies saying that there could be post-finasteride syndrome, saying that there is sexual dysfunction. So overall, we just need to better study it. And this is an important thing to talk about: men's health. Men overall are terrible about taking their health. I know because I'm a man. I'm terrible about taking care of myself. And men overall aren't willing to admit their health problems, especially when it comes to sexual dysfunction and mental health. Men overwhelmingly are unwilling to discuss it. So there is a very good chance that even in these studies, it was underreported by the men because they were embarrassed. They didn't want to talk about it. And so I think it is something that needs serious consideration. If you're going to start finasteride, you seriously have to think about that. Anyone with a pre-existing history of sexual dysfunction, depression, anxiety should talk thoroughly with the provider who is prescribing them this medication. Tread carefully and be educated. What do you guys think? Like, comment, follow for more. Let me know what else you want to talk about. If you really want, I could go over a longer video going over all the data that is present, but I figured it wasn't worth it for the time of this video. Have a good day. Bye. Oh, It is also worth talking about that there are some studies, just like I mentioned, women can't even touch the dust from the pill because the risk of systemic absorption. There are some studies looking at topical finasteride and systemic absorption. So there is still a theoretical risk that if you apply finasteride topically, that you may still have those sexual dysfunctions. Now, albeit it is physiologically sounds like it would be a low likelihood, but it's still something worth considering. Have a good day.